Welcome to Rendon Orthodontics. We're really glad you're here.
We have a lot of patients that only come to see us just because they are concerned about we call it the social six. It's basically the six front teeth on the top that normally those are the ones you show when you smile, and they are concerned about how they look. But we look at the patient's overall oral health. We check how the bite is on the sides, how it is the relationship between the upper and the lower jaws. So that's important because at the end, we're gonna provide the patient a better aesthetics, a better function, and also it's gonna be easier for the patient to clean. The teeth are gonna look a lot better. They're gonna last longer. So we wanna make the patient aware that it's not only the aesthetic part, it's also the functional part and how the teeth are gonna be meeting each other in the upper and the lower jaws.
And that's what differentiates a specialist. A specialist is somebody that has extra training. You know, we go to dental school and then we go back to school for at least another 2.5 to 3 years. And we don't take that lightly. I mean, if you need a heart surgery, you wouldn't go to your family physician, you would probably go to the cardiologist. And that's exactly what happens with orthodontics.
I have a patient that came to me because he did some kind of treatment where his teeth were not aligned on the front. They aligned the teeth. When you look at the alignment, it's good. But when the patient was closing his mouth, it was not biting on the back. It was basically biting mostly on the front. So the patient wasn't comfortable eating. And it's like, okay, I have this procedure done and it's not working. The way they prescribed the treatment was just to align the teeth. Basically, they didn't care about how the upper and the lower teeth were meeting. And then we have to do braces and start using some rubber bands to get the bite corrected. And then it's changing the way he functions, it's changing the way he eats. It's completely different, even though he had some aesthetics because the teeth were completely straight, but the function was not there. So we have to approach the patient in treatment in a different way to get the results that he was looking for.
Different kinds of forces, vectors of force that are not correct on the teeth can create recessions, which is the gum, losing some bone and the gum, following the bone.
Exposing the roots.
Yeah, and the teeth can be mobile, to the point that when we have anterior cross bites, there's a wrong vector of force, so those teeth can be lost throughout life.
So if you have your teeth wearing the normal way, they're gonna last longer and you're not gonna have that sensitivity on your teeth, basically.
So we're not only concerned about the aesthetics, that's very important, but we are very, very concerned about the function of teeth, and we want to keep people's teeth as healthy as they can possibly be throughout their life.